Hi, welcome to the GPAT Preparation Series 3 test number 13. This test series will be helpful in preparation for the GPAT exam. We wish you all the best. Before we start the test, let us understand the process. So, here is the process. This test consists of 10 questions, and you will get 7 seconds to write your answer in the comments. For example, if the answer to question 1 is option B, you can write it in the comments as 1B. Similarly, if the answer to question 2 is option A, you can write it in the comments as 2A. So, the first question is: there are two methods by which the duration of action if insulin may prolonged. P. Binding with resins. Q. Esterification of amino acid residues. R. Forming of complex of insulin with protein. S. Modification of particle size. Option A, Q, R. Option B, R, S. Option C, P, S. Option D, P, R. As you know, you have got 7 seconds. If you know the answer, mention it in the comments. The time starts now. The time is over. I hope you got it right. The correct option is A, that is Q, R. Now let us quickly move to question number 2. Which drug molecule does not have phenylethyl amine moiety? Option A, amphetamine. Option B, glyburide. Option C, phenyramine. Option D, mescaline. You have got 7 seconds. If you know the answer, mention it in the comments. The time starts now. So, the time is over. Let us see the correct answer. The right option is B, that is glyburide. I hope you are participating in the test and writing the answers in the comments. That is awesome. Let us move ahead. So, the next question is: which of these is true about the discovery of HB antigen in the blood of people infected with hepatitis-B? Option A, it provided a basis for vaccine design. Option B, it indicated that specific vaccines cannot be designed for hepatitis-B. Option C, it has not been of much significance. Option D, it indicated that hepatitis-B is a viral disease. Mention your answer in the comments. You have got 7 seconds. Let us see the correct answer. The right option is A, that is it provided a basis for vaccine design. I hope you are ready to take the next question. Here it is. Autoimmunity refers to: Option A, an automatic trigger of the immune system directed against a specific pathogen. Option B, failure to distinguish between self and non-self. Option C, an automatic segregation of T and B cell. Option D, failure of B cell to interact with T cell. Mention your answer in the comments. Your time starts now. Let us see the right answer. The right option is B, that is, failure to distinguish between self and non-self. Here is the next question. Let us see if you know the answer. A patient showing muscle rigidity, bradykinesia, tremors and postural instability was administered levodopa. Which of the properties of levodopa is not true? Option A, levodopa is preferred over dopamine because it can cross the blood-brain barrier. Option B, levodopa is the levorotatory stereoisomer of 3,4-dihydroxyphenylalanine. Option C, levodopa gets decarboxylated in the brain to dopamine. Option D, levodopa is administered because of its strong antagonistic action on dopamine receptors. Your time starts now. Here is the answer. The right option is D, that is levodopa, is administered because of its strong antagonistic action on dopamine receptors. Few more questions left, let's move ahead and take the challenge. Azithromycin is clinically administered once daily, as compared to erythromycin, which is administered every 6 hours because azithromycin. Option A penetrates into most tissue and is released very slowly. Option B has a methylated nitrogen in its lactone ring, which renders it much more potent than erythromycin. Option C is a very potent antibiotic but not tolerated well in the gastrointestinal tract. Option D is usually presented in a sustained release dosage. Your time starts now. The right option is A, that is, penetrates into most tissue and is released very slowly. Few more questions left, let's move ahead and take the challenge. Which one of these best describes a process carried out to render a drug pharmacokinetically more acceptable? Option A, enteric coating of diclofenac. Option B, co-administration of aspirin with antacids. Option C, use of colloidal suspension or liposomes for administering amphotericin-B. Option D, synthesis of an analog to obtain high receptor specificity. Only 7 seconds left. Post your answer in comments. The right option is C, that is, use of colloidal suspension or liposomes for administering amphotericin-B. Wow, you are participating really well in the test. Let us see if you can answer the next one. The breakdown of fibrin is catalyzed by Option A, plasmin. Option B, renin. Option C, urokinase. Option D, tyalin. Your time starts now. I hope you could find the right one. Only 7 seconds left. Post your answer in comments. The right option is A, that is plasmin. Here is the next one. A patient with rheumatoid arthritis has been taking acetyl salicylic acid regularly. However, recently she has been experiencing stiffness, swelling and pain due to salicylate resistance. She has occult blood in her feces. Suggest an appropriate drug suitable for her from those mentioned below. Option A, paracetamol. Option B, celecoxib. Option C, pyroxicane. Your time starts now. I hope you could find the right one. Only 7 seconds left. Post your answer in comments. The right option is B, that is celecoxib. Here is the last one. Give it a try. An electrochemical method that enhances the transport of some solute molecules by creating a potential gradient through skin tissue with an applied electrical current or voltage is called. Option A, electrophoresis. Option B, lontophoresis. Option C, osmosis. Option D, implants. Your time starts now. I hope you could find the right one. Only 7 seconds left. Post your answer in comments. The right option is B, that is lontophoresis. Since you participated in all the questions of this GPAT Preparation Series 3 test number 13, we really appreciate your effort. We wish you all the best for your GPAT preparation. See you soon in the next GPAT Preparation Series video.